Hello, everybody. Thank you so much for joining us today at SRC University. Our topic today is going to be Medicare for 2024, 2025, and what's happening in 2026. My name is Tara, and I'm here with Bill Witt, and we are going to be your moderators for today. Okay, so SRC University, we designed to help people with retirement education, and we make these sessions really easy. No more than 30 minutes long, and they're available at your schedule. So you can go online to our website and click and listen to any of them at any time you want. A lot of the topics we'll be covering in SRC University come from our book. So if you're interested, you can download our book for free on our website or send us an email and we can send you a soft copy in the mail. Our ultimate goal here at Senior Resource Center is to create a safe, secure retirement for people. And the good news about this university is there's no final exam. So how do we help at Senior Resource Center? Well, we do 4 distinct things. We help with comprehensive retirement planning, and that includes helping people look out 20 and 30 years in advance to make sure that they're not going to outlive their money. We also do tax planning, not tax prep, but we help people find ways to pay less tax in retirement. We do a lot of long-term care planning, including helping people qualify for federal and state programs like VA aid and attendance and Medicaid, and being able to protect and preserve all of their assets. And then lastly, estate planning. So just making sure you have your legal house in order and you have your correct documents for while you're living and then when you've passed on. So with that, I will pass it over to Bill.
Thanks, Tara. Welcome, everybody. Today's topic is an important one because as we move into retirement, if you've received any medical bills over the last 10 or 15 years, you know the cost of modern medicine keeps going up. And so for most of us, we will rely on Medicare for our health care and retirement. So it's very important to understand all of our options. And understanding those options helps us create a safe, secure retirement plan. You know, if you kind of look back to the beginnings of Medicare back in the late 60s, there's different parts to Medicare, and the Medicare Part B premium literally back in 1970 was only $5.30. We'll see today that that amount's gone up to $174.70 each month in 2024. So as I said earlier, the cost of modern medicine is going up, and having the right choices, the right Medicare options, helps you control your cost of medicine and medical care in retirement. So today's topics, we'll briefly go through what is Medicare. We'll talk about what's new in 2024, 2025, and into 2026. We'll focus heavily on the 2024 Medicare options, the different choices you can make in selecting medical coverage. We'll talk about the process of enrolling in Medicare. We'll talk about employee choices, because sometimes people that turn 65 and are eligible for Medicare are still working. And so they have a variety of choices, and we'll explain that. We'll then talk about some tricky situations that we've encountered over the years that involve Medicare. And finally, we'll hopefully allow it time for your questions at the end. So what is Medicare? Medicare is health insurance for people 65 years of age and older, and for some people under 65 with certain disabilities, such as people with end-stage renal disease. The program is administered by the Centers for Medicare and Medicaid Services, or CMS, and it's augmented by private insurance companies. We'll talk about how all these different parts of the Medicare solution fit together. And finally, where do you sign up? Well, you can do it at the Social Security website, www.ssa.gov. That's where you sign up for your Medicare benefits. So if you've turned 65, you're probably getting a copy of Medicare and You every year in the mail. And if you're like me, you look at it and go, gosh, that's a pretty big book. Do I have to read all of that to understand my Medicare options? And the good news is, no, you don't. In front of us right now is a chart that we created to help simplify the understanding of how the different Medicare pieces fit together. And we'll be talking through this chart at length today so you understand how to build a safe, secure, and complete Medicare solution. So let's first start out and talk about, Medicare keeps changing. What was new back in 2023? Well, for the first time, they limited the cost of insulin for many drugs that are available down to $35, or for an insulin pump under Medicare Part B. And that helps a lot of people that need insulin. They changed the enrollment option. There's a number of ways you can enroll, and we'll talk about one of them is the open enrollment period that runs from January 1 to March 31st every year. But now it starts the first of the next month. So if I enroll January 15th, my benefits would start on February 1st. They also added new vaccines, including one for shingles. A lot of people are worried about that, and so that's now covered. The Social Security website was redesigned, hopefully to make it easier, and back in 2023, they extended warranties on hearing aids. So let's dive into the chart that I mentioned earlier. 2024, this chart summarizes your Medicare options. You see the page is divided up kind of left and right. Let's start out on the left side of the page, and I call that Original Medicare. In the two boxes I have highlighted at the bottom, Medicare Part A, that comes from the government. That's your hospital and rehabilitation or nursing home benefit. It has no premium. Most people get Part A for free. It does have a per event deductible. And so, and that happens to be $1,632. So let's say all I have is Medicare A and I break my leg. Well, I go to the hospital, I would pay $1,632. If 2 months later, I come down with pneumonia, I'd go back for a different benefit period and I would have to pay another $1,632. There's also a copay based on the number of days of coverage that I receive, and that can get pretty pricey. On the right side, you see Medicare Part B, and that's your doctor and lab coverage. And there, most of us today pay $174.70 per month as our Medicare B premium. Higher income individuals do pay more for Medicare Part B. Part B has an annual deductible, not a per event, an annual deductible that's only $240. And then after that, generally it's 80-20 cost sharing. Medicare pays 80%. And if all I have is Medicare Part A and B, if I go to the doctor after I've met my deductible, I would pay 20% of my doctor visit or lab visit. You also see in small print excess charge. Doctors actually can charge 15% above the Medicare assignment rates. So every procedure that a doctor provides has an assignment rate, which is an amount the doctor gets paid for checking my blood pressure or whatever. And doctors actually can charge over the standard assignment rate, 15%. Very few doctors do, but occasionally it comes into play. So that's Original Medicare Part A and B. This is what comes from the government. Above that, you see another box that I call Medicare Supplement / Medigap policy. Originally, these policies were called Medigap programs or policies because they filled in the gaps of what Part A and Part B don't pay. They're offered by private insurance companies. So you can only get Part A and B from the government. You can only get a Medicare supplement, or they're also called Medigap policies, from a private insurance company. These are lifetime plans. And today there's a template with 10 standard plans A through N. So if I'm on a plan F, or let's say a plan G, the same benefits that would come from one company will come from another. So plan F with 3 companies is always plan F. And the same is true with plan G. Plan F is a available option for people who were 65 by January 1 of 2020. And it was very popular. It has no copays, no deductibles. So I pay my premium for plan F. I pay my premium for Medicare Part B. And then if I went to the doctor, the lab, or the hospital during the calendar year, I had no copays, no deductibles. So I go in for expensive surgery that's several $100,000, and I pay $0, and I feel pretty good about that. Now, if you're younger than you weren't 65 by January 1 of 2020, you can sign up for Plan G. It has no copays. The only out-of-pocket is that small $240 deductible for Medicare Part B. Like Plan F, once I've met that $240 deductible under Plan G, I could spend $1 million getting chemo at MD Anderson in Houston, and I'd pay nothing for it. So that's the two different, that's the Medicare supplement block. Most people start out, they get Part A and Part B, and then many people, we help people select and get a Medicare supplement. And we explain how they work and how they interact with Part A and Part B. Now, I said there were 10 standard plans. I've highlighted 3. Plan F for people that were 65 by January 1 of 2020. Plan G, which is that second plan I mentioned, only out of pocket is the Part B deductible. For people that are operating on a limited budget, there's a third option. It's called Plan N. And here you'll see that there are some copays. There's a $50 copay in the emergency room. There's a $20 copay if you go to a doctor or a specialist. And other than that, it's still a very good plan, and it costs less. You have to pay your Part B deductible. It doesn't cover that, just like Plan G. So these are the 3 different plans that we show our clients so they can understand different choices. Now, going back to our main chart, on the left side, you'll notice the 4th box at the top is Medicare Part D. These are prescription drug plans, and they became about in 2006. Before that, Medicare didn't help with drug coverage, but now it does. And so these plans help defray the cost of prescription drugs, and they've made significant improvements on Part D plans. They're annual plans, which, unlike a supplement where when you sign up, you can stay on it for life if you want to, with a prescription drug plan, the plans are annual. They run from January 1st to December 31st. They have copays for drugs depending on what type of drug it is, whether it's brand name or generic. There is a donut hole. We'll explain that and talk a little bit about that. But the good news about drug plans is that we help our clients understand how to use a website, medicare.gov. And why do we use that? I said these are annual plans. Every year, our clients need to go back to medicare.gov during the annual election period. That's from October 15th to December 7th. And they can build a drug list, pick a pharmacy, and then this website helps identify the plan for the coming year with the lowest annual cost. So we don't sell or offer drug plans, but we help our clients make informed choices so they're always paying the least. So Part D, as I said, the annual eligibility or annual election period is from October 15th to December 7th. You go to medicare.gov. You can create an account, but you don't have to. And it's very simple to use. You build a drug list by entering the name, dosage, and frequency of each of your drugs. You select a pharmacy, and then the beauty of this website, it identifies the plan. In 2024, there are 21 plans. It shows you the plan with the lowest annual cost. And that cost includes your premium, deductible, and all of your copays. And so usually people pick the plan at the top of the list. It shows the cost for all 21 plans. During this annual election period, October 15th to December 7th, you can evaluate plans and decide if you want to switch to a different plan. If you don't make a change, you'll stay on the plan you're on for the coming year. But if you find a plan during this annual election period that offers better cost savings, you switch. And by automatically enrolling in a new plan for the coming year, it will disenroll you from your current plan. So let's talk about the drug plans. There used to be 4 phases of coverage for drug plans. The deductible phase, some plans have a deductible, some don't. This year, the average deductible is $545. Then there's the initial coverage period, and that's where you pay 25% of drug costs up to a total of $1,257. And that's 25% of drug cost. If your drug costs are $5,030, you'd pay the first 12, you pay $12.57 of that. Once you've hit the drug cost limit of 5,030, you move into what was formerly called the donut hole. And the problem with the donut hole, this was called the coverage gap. In the early days of drug plans, you had to pay the full price of your drug. Now, if it's a generic drug, that doesn't probably cost much, but brand name drugs could be quite pricey. You were paying 100% of the cost. Well, with the Affordable Care Act that was passed during the Obama administration, they now limit the cost sharing still at 25% of the cost of drugs. And the good news is they've capped in 2024, they've capped your out of pocket at $8,000. So if you're on very pricey, expensive drugs, once you hit that $8,000 limit, you don't pay any more in copays the rest of the year. And that's good news for people on very expensive, like cancer drugs. So what changed in 2024? Well, they reduced spending on some of the expensive drugs, and they eliminated that fourth phase. Used to be when you were in the catastrophic phase, you had to pay 5% of the cost of the drugs, but today it's limited to $8,000. And, with all changes, we anticipate drug plan premiums may increase in the future. 2024, they really didn't go up a whole lot. What about what's coming in 2025? Well, more reduced spending for expensive drugs. The coverage gap, that phase, is eliminated completely, and they're going to limit in 2025 the out-of-pocket limit at $2,000. So once you hit $2,000, no more copays on drugs as long as they're covered under your drug plan. We do expect drug plan premiums may increase to offset some of this, but for people, once again, on expensive drugs, having a $2,000 cap or ceiling will feel very good. And finally, what's going to happen in 2026? Well, the government has finally done something that people have talked about for a long time. If you go to another country, to England, France, Canada, Mexico, all of these companies have nationalized health care, which means that the government has negotiated with the drug carriers on what the price of various drugs will be sold in their country. But we've never allowed Medicare to negotiate with the drug companies. But starting in 2026, Medicare will have the ability to negotiate the price of 10 very expensive drugs. And these are the list of drugs that they're going to start out. Hopefully they will expand this list to reduce the cost of drugs in the United States. So let's go back to our chart that we started with. And remember, I said there's two sides. There's original Medicare on the left. We've been talking about that. I want to spend just a brief amount of time talking about what's on the right side of the page. Back in 2006, when they created the prescription drug plans, they created another part of Medicare. It's Medicare Part C. These are called Advantage plans. There are both individual Advantage plans and some employers. My wife is a retired teacher. She was offered a TRS Advantage plan when she retired. So there can be group Advantage plans and there can be individual Advantage plans. Now, when these plans came out originally, there were 4 different styles. PPO, which is an open network where you can go to providers both in and out of network. HMO, where you have a closed network. You must go to an in-network doctor to get coverage or an in-network hospital to get coverage. If you went outside, you'd pay the full price of coverage. They also had private fee-for-service plans, and there are special needs plans for people that are on both Medicaid and Medicare. These plans are offered by private insurance companies. And you'll notice this one box kind of replaces everything that's on the left side of the page. So if you're on a Medicare Advantage plan, you still pay your Medicare B premium, but all of your claims, they no longer go to the government or to a supplement company. Now all of your claims are funneled through the private insurance company that offers the Advantage plan. We have some concerns about Advantage plans. They generally have much lower or no premiums at all, so they can look very attractive. And if you'll notice, between October 15th and December 7th, there's a lot of ads on TV promoting Medicare Advantage plans. But what those ads sometimes don't talk about are limitations on provider networks, on who you can go to receive care. Advantage plans also can have hidden costs. They may have no premium, but sometimes when you start pressing and using the plans extensively, you'll run into hidden costs. So if you're rubbing two nickels together to make it through retirement, you can consider Advantage plans. If you have the funds to support the left side and afford a supplement and a drug plan, that's what I'm on, and I enjoy the coverages that I have there. But if you do want to consider an Advantage plan, make sure you check with all of your medical providers and the hospital that you might use to make sure they accept your specific type of Advantage plan. This last year in 2023, notices went out that certain providers in Central Texas were no longer accepting insurance from a particular provider. Not going to mention the company, but this created a lot of concern. People contacted us and say, does this mean they will no longer accept my Medicare supplement? And I had to say, no, they need to be more discerning in their announcement. Your supplement is still fine, but if you have an Advantage plan with that particular company, what they're saying is they don't accept that Advantage plan. So just because I'm on an Advantage plan with company A doesn't mean the doctor also accepts Advantage plans from companies B, C, D, or E. You have to be very specific when you're on an Advantage plan to say, I'm on this company's plan, doctor and hospital, do you accept it? So let's talk about enrolling in Medicare. To enroll in Medicare, you need one of three triggering events. The first one is pretty obvious. I'm turning 65. I have a 7-month window, 3 months before my birth month, the month of my birth, and 3 months after. And if I sign up during my birth month or after, my coverage starts, it either starts the first of my birth month, can't start earlier than that, or the first of a later month. So turning 65, everybody is eligible that has worked in this country is eligible for Medicare benefits. Now, some people work past age 65. And if they do, they have a choice. We'll talk about employee choices, but they could stay on group health past age 65. So for them, the triggering event is losing or dropping group health. And within 63 days of dropping group health, ideally before you drop group health, you want to apply for and get your Medicare A and B going. Coverage starts the first of the next month. The third triggering event is that general enrollment period I mentioned from January 1st to March 31st each year. And if I sign up during one of those months, my coverage starts the first of the next month. So let's talk a little bit about employee choices, because this can be a confusing area for a lot of folks. Many people are working past age 65 now, and one of the most frequent questions we get is, Bill, I'm working past 65. Do I need to do anything with Medicare, or can I wait till later? I don't want to incur a penalty. Well, the decision on this depends on to stay on group health or to drop group health depends on how many employees are in the group health plan. If you work for a small company that has less than 20 employees, signing up for Medicare Parts A and B can be very important, because Medicare in a small employer situation is primary. So let's say I'm working for a small company. I don't sign up for Part A and B, and then I have a major medical event during the year. Well, the carrier that provides our group program could well say, Bill, did you sign up for Medicare? Because that is primary. If you didn't, we'll pay when Medicare, after Medicare pays, because they're primary. But since I didn't sign up, Medicare would never pay, then I could be out of pocket. So if you work for a small employer and you choose not to sign up for Parts A and B, get something in writing from your group health plan saying that they will cover you no matter what. Now, if you have more than 20 employees, then the group plan is primary. And signing up for Medicare Part A and B is not necessary. You definitely don't want to sign up. If you're going to stay on group health, you don't want to sign up for Medicare Part B. Why? You're paying a premium for it monthly, but since the health plan is primary, you'd have to exhaust all of the benefits from your group health plan before Medicare would start. And so usually signing up for Part B, if you're going to stay on group health, is not a good choice. So when I turn 65, or when I'm looking at group health versus enrolling in Medicare, what are my choices? Well, I can always drop group health and sign up for Medicare Parts A and B. I could select a Medicare supplement and a drug plan, or I could add on an Advantage plan and I would be covered under Medicare. Or I can choose to stay on the group health plan past age 65. And then when I know that my retirement is coming up, usually 60 days before you're going to retire, you want to have a form filled out by your human resource department that says Bill was covered under group health past age 65. He's losing group health the 31st of some month, and that's a triggering event. So there's a form that we give out to our clients that helps them. They take it to HR and get HR to fill it out, and it says Bill is losing group coverage. That tells Social Security that I have a triggering event and I can get Medicare. Now, over the years, we've run into a number of tricky situations, and I want to touch on these briefly so you'll know these are things to be very careful. One is health savings accounts, or HSAs. If your company offers an HSA, pay attention to what we're going to cover. Most companies offer a service called COBRA, which is, I call it extension insurance. I'm still working, or I'm going to stop working, but I choose to carry my group health beyond my retirement date under COBRA coverage. And we'll talk about where that fits and where it doesn't. Sometimes people that are on a group plan have a spouse that's younger than 65. We need to consider that situation because they too need coverage. Sometimes people face high drug costs, and we need to talk about that. And then there are high income surcharges that we can avoid if you know how to do it. So let's talk about first health savings accounts. These have become very popular. While you're on a health savings account, you can't be on any form of Medicare, Part A or Part B, because you as an employee are making pre-tax contributions, and your employer may well be making pre-tax contributions. If you're on Part A or B and you make pre-tax contributions, you will face a tax penalty. We don't want to incur that. And where this gets even trickier, let's say I'm past age, my full retirement age, I'm now 67, 68, and I'm going to drop group health. And I'm also going to sign up for Social Security benefits. Well, when you sign up for Social Security benefits past age 65, the Social Security Administration automatically starts your Medicare Part A 6 months earlier. Well, if I've been on an HSA plan and I've been making contributions, I'm now going to face a tax penalty. So if you're working past age 65 and you're on an HSA, realize you've got to stop. Both you and your employer have to stop making contributions 6 months before you retire and sign up for Social Security. If you have questions on this, call us. COBRA. Well, dropping COBRA or COBRA ending is not a triggering event. I said losing group health coverage is, but COBRA isn't. So let's talk about where this can be problematic. Using COBRA younger than 65 is fine. I'm 64 and I've got COBRA coverage that'll bridge me into age 65 Medicare benefits. It's fine. But what if I stay on COBRA past age 65 and let's say it expires mid-year? Well, losing COBRA is not a triggering event. If I lose my COBRA coverage, say on June 1st, I have to wait till the following January 1st to March 31st, that open enrollment period, to sign up for Medicare A and B because I don't have a triggering event. And in that case, I'm going to have late enrollment penalties for Part B and Part D. Part B is your doctor and lab coverage. Part D is your drug coverage. You'd have late enrollment penalties. So the simple answer is COBRA before age 65 is fine. After age 65, not good. What if I've got a spouse younger than 65? I'm going to retire. I'm going to leave my employment. And what if my spouse is on my group health plan? Well, if we have less than 20 employees, there is what's known as state continuation. That younger spouse can get up to 9 months of coverage. But if my spouse is only 62 or 63, that could be a problem. 9 months doesn't bridge him or her into age 65 Medicare benefits. If we have more than 20 employees, COBRA usually runs either 18 months or 36 months. Check with your HR department to find out how long of coverage. If your spouse is only a year away from age 65, not a problem. But if they're 62 or 63 and my COBRA only lasts 18 months, there's going to be a problem. There'll be a gap, and none of us can afford to go without health coverage. One trip to the hospital can bankrupt people. So there we want to look at the Affordable Care Act as an option to bridge into age 65, or possibly individual health insurance. Either way, everyone needs coverage. Without coverage, you're at great risk. What about high drug costs? Well, this is being whittled away by the improvements they're making into Medicare. In the old days, when you hit the donut hole, drug costs could be outrageous. Over the years, we've looked at a number of ways for our clients to minimize the impact of drug costs. Remember, I said other countries have nationalized healthcare where their cost of drugs is very much reduced because it's negotiated, but not so in the United States. So let's talk about a number of ways to minimize drug costs. Oftentimes today, brand name drugs now are available in a generic form. Now, I'm not a doctor. I can't tell you to take generic or brand name. That's up to you and your doctor. But if there's a generic equivalent that is chemically the same as the brand name drug, you might ask your physician, hey, doc, you're putting me on a new drug. Is it brand name or generic? It's brand name. Is there a generic equivalent I could try first? That's a way of getting reduced cost. Another option that's always great, ask for free samples. So who calls on doctors? Brand name drug salesmen. And they always give the doctors free samples. If it's November and I'm getting near the end of the year and I need to bridge into the next year, well, sometimes asking for free samples can be that bridge. So always ask for free samples. Never hurts to ask. A third option, which is a good one, my wife uses this on one of her drugs that are expensive. You can buy drugs directly from the manufacturer. Each company has its own set of rules. But if you take a drug from Pfizer or Squibb or one of these drug manufacturers, you can go to their website and they will all have buy direct plans that allow people with limited resources and limited income to acquire the drugs they need at a much reduced rate. You'll see this in their ads. If you need help paying for your drugs, contact us directly. That's always a good option. A fourth option is one my business partner Tara shared with me, GoodRx. I carry a GoodRx card in my wallet. When I go in for a drug, if it's a brand name drug and the cost is $200 or $300, I always ask, what's the GoodRx price? Many times, not always, but many times, the GoodRx price is a lower price. And I go, hey, forget about using my Part D plan. I want to buy the drug directly using my GoodRx card, and I get a reduced price. The last option is one I can't recommend, but many of our clients have done it. And they've headed north. How far? Well, think Canadian border. As I said, Canada has nationalized healthcare. Some people use Google. They Google Canadian pharmacies. They find a list of pharmacies. And when they go to their website, it says, what drug are we talking about? And it's XYZ drug. And you can see what the cost of the drug north of the border would run you. And if that's a good option, I understand you can have your physician fax a prescription to the drug company, the pharmacy north of the border, and they will ship the drugs directly to you. The last item that I want to talk about is something that people don't realize, but high income people pay higher charges or higher fees, higher monthly premiums, or have a higher cost for two parts of the Medicare program. One is Medicare Part B. I said that this year, most people pay $174.70, and that depends on your modified adjusted gross income 2 years earlier in 2022. So you can see these ranges. If you reported income, modified adjusted, think of it as your adjusted gross income. If your adjusted gross income was above these bands, you pay a higher premium monthly for your Medicare B. But, oftentimes people retire or someone dies or they get divorced and income drops. Well, fortunately, there's a form You don't have to wait 2 years paying the higher premiums. There's a form you can fill out, a change of life form that we make available that says, hey, I retired at the end of last year. I'm now making less. I would like to have my Medicare B premium adjusted to what I'm currently making, not what I made 2 years earlier. And you can see some of these monthly premiums are much higher. So filing that form can save you a bunch of dollars. Also, the Medicare Part D, there's a surcharge. Most people don't pay the surcharge, but if you're in one of these higher income bands, you too will pay a higher monthly fee on top of whatever the monthly premium is for your prescription drug plan. By reporting lower income this year, you get the lower surcharge. Well, we covered a lot in a very short period of time, but I think the takeaway from this session is understanding your Medicare options is important to making smart, informed decisions. And we welcome your calls. Our consultations, our phone calls are always free. Come to our office. We're happy to help you explore your options so that you're making the most cost-effective decisions to keep money in your wallet, not paying for medical care that you can avoid. If you need help with this, give us a call. You can email us. And I'll mention again our book that's available on our website. You can download it for free, a PDF, or you can drop us an email at Bill, Tara, or Stacy at srctexas.com, and we're happy to mail you a free copy of the book. Thank you for joining us today. Have a great week.